All right, guys, this week on Nurses Making the News on Thursday, we have another story of what not to do. Yes, that is correct. What not to do. This week, a doctor and a nurse are both being found on trial for involuntary manslaughter in the death of a patient who came in for a breast augmentation surgery. The two worked at a plastic surgery facility in California. This place actually looks legit. It does not look like some sort of back alley, used to be a mini storage facility, sort of horror story that you're known for. This looks like a legit medical center. I mean, pictures of it are pretty nice. In any case, and I'm probably going to pronounce these wrong, Dr. Carlos Chacon and the nurse Heather Lang Vass are being accused of the involuntary manslaughter of the patient Megan Espinoza. Megan Espinoza came in for a breast augmentation surgery. When she had the surgery, at the end of the surgery, it was found that she went into some sort of cardiac arrest. Now, is there risk in surgery? Yes, we should all know that there is risk in surgery. However, things did not go as planned, so to speak. I mean, in the news articles, it says that a non-licensed medical assistant gave Ms. Espinoza her injection of anesthesia. So that right there is your very first red flag, huge red flag, and the medical assistant is not named in the article, probably not named in court documents either, as the medical assistant was instructed to do so. The medical assistant did not act independently, probably why this individual is not named in any of the documentation. Following the procedure, and I honestly don't know if it is related to the anesthesia or not. Chances are it probably is, or it would not have been mentioned. Following the procedure, Ms. Espinoza's condition began to worsen, and she deteriorated rather quickly, with the doctor calling his colleagues trying to figure out what to do. Somebody said that he was instructed from another provider to call the ambulance, get Ms. Espinoza out of there. They waited 3 hours before medical attention was brought to Ms. Espinoza. Poor Ms. Espinoza died a little over a month after the procedure. Although the surgery took place a few years ago, it is just now coming to trial. I'm not sure why. It could be COVID related as to why it's just now getting to trial. However, it is just now getting to trial. These are lessons of what not to do. And something that is also quite disturbing, at least in my mind, is the doctor still allowed to practice, even though this is a pending charge that faces legitimate time in prison. With this pending charge, this doctor is still allowed to practice as long as he has somebody who is licensed, a licensed anesthesia specialist, a nurse anesthetist, or an anesthesiologist. Ooh, I can't believe that is allowed to happen, even with these pending charges. There's also a pending civil suit by Ms. Espinoza's husband. I'm not surprised there, as well, as this sounds pretty bad. So let's break it down as to what really went wrong here. Number one, the unlicensed professional may or may not have ever had any other medical position, may or may not know any better. Could be why this individual was not even mentioned in any of the news articles. As a provider, you should know what your licensed and unlicensed people can do. As a nurse, you should know what your licensed and unlicensed people can do. Somebody should have thrown the red flag right there. All right, let's go ahead and get that out of the way. One thing that I have been taught since day one, and that I continue to tell people, is you can always send help back. You can't always get help there. In any case of any emergency, you want too much help too early. Always hit that button first, then tell everybody, oh, thank you guys so much for showing up. I'm so sorry. We don't need you anymore, but thank you for coming. The fact that these people waited 3 hours, and not only that, also got that advice from another provider, is a big red flag. I can't believe that even the nurse even allowed this to happen, as this is part of your BLS training, your basic life-saving training. And chances are she was also advanced life-saving training. I mean, the fact that really anybody let this happen is ridiculous in my mind. Always call for help, especially when you think you need it. As Miss Espinosa's health began to very rapidly deteriorate, I mean, within 3 hours, that's pretty quick. You should have known an issue was going on within minutes if within 3 hours she was in very bad condition. You should have known quickly, hey, you know what? We probably need to send her out. Probably need to get her to the ED. Probably need to get somebody else in here with more eyes on us at this moment in time. Not sure if they didn't want to get in trouble. I'm not sure why they didn't do it. One thing that this leads me to believe, especially with the unlicensed medical assistant doing the anesthesia, that this medical center has actually been doing this for a while. Again, this is my opinion. This is not fact that is stated. But with all the red flags that's going on here, this is sort of leading me to believe that this is common practice at this medical facility, because this medical facility looks legit. It does. It does. Like I said, it does not look like some mini storage facility that you hear about in horror stories. This looks like a legit medical facility. And the guy's a doctor, like a legitimate doctor. So these sound like common practices at this place. I hope that everything changed after this. I really do. I mean, I don't want to see anybody ever go to a surgery where you don't know that everybody's licensed or not licensed or even qualified to do the job that they're doing. But it just sounds like this was a common practice at this facility. Ugh. If you ever find yourself in the position where you just don't think your facility is doing things correctly or how they should be done, go ahead and get yourself out of there, or ask plenty of questions and make sure, yeah, this is okay, or no, this is not okay. Avoid situations like this. Now, as I said, the doctor is still allowed to practice. It doesn't say anything about the nurse, and I'm fully aware that California has some very strict nursing laws. Yeah, they're strict on nurses for some reason, but let everything else fly. And I don't know that this nurse is even allowed to practice anymore. Probably not, given the fact that she's in California. But somehow the doctor is still allowed to practice. And this crime holds legitimate prison time. Like, you go to prison for this one. Yes. And it's not looking really good. Neglect all the way around on this one. Don't be that nurse. If anything ever comes up and you feel like you're going to get in trouble for doing the right thing, just go ahead and do the right thing. Answer the questions later. Just go ahead and do the right thing. The nurse should have known on this one. Let's go ahead and call the ambulance. This woman looks bad. Let's get her out of here. Let's get some help. Let's do something. And it just sounds like nothing was done for 3 hours. That is a long time with deteriorating health. A long time. Like this video, you should check out all of the other nurses making the news on Thursday. There should be a playlist down below. Don't forget to like, share, and subscribe. It's on this side over here. And if you like this video, check out another video. Should be over there. Thank you so much. What are your thoughts on this one? Let me know. I'm genuinely curious. Thank you much. Hope it helps.